Hi, good afternoon, everyone, and a very warm welcome to all of you. I'm Dr. Urvi from Prudent Insurance Brokers, and I would like to thank all of you for joining today for the session. We are very excited for today's session and hope you all are too. So, I'm sure you all are very curious about viral infections. How do they happen? What is the reason? How can we prevent them? And I'm sure you would also want to know how to unlock the secrets of all these sneaky intruders amongst us. Well, there's a lot that we want to know about viral infections and our personal surroundings, our experience. So let's know more about it from the veteran himself. So today we are joined by Professor Ashok Ratan. So he is a medical microbiologist by profession, and he is conferred by APJ Abdul Kalam Award for his lifetime contribution towards that field. And he holds numerous accumulates to his name, and he's one of the very well-known figures amongst the society. And he is currently also the chairman of Medical Committee and Quality of Redcliffe Labs. So I'll hand over the floor to you, Doctor. Please to continue.
Thank you. Good afternoon, everybody. As just mentioned, that we will deal with some of the viral infections. What are the symptoms so that you can recognize that you have viral infection? What are the causes and what are the preventions? And then we would deal with any questions or any doubts that you have in mind as a question and answer session. Microbiology was born when Anthony van Leeuwenhoek, who was actually a tailor, but in his hobby he used to play with various lenses, and before he buys any cloth he would see the fiber, and he found that by using the magnifying glass he could study the fibers better so that he can buy a better quality of cloth. Then by putting two and two together and two magnifying glasses together and taking a sample from his mouth, he found that there were small animals that he could see under the microscope. That was the beginning of identifying that there is a whole world that we cannot see with naked eye. That's how microbiology was born. Then it was Louis Pasteur, a chemist by profession, who was invited by the French wine industry to solve their problem because the wine was losing its tastes. Louis Pasteur started doing various experiments, and he identified that it was contamination of wine that it was spoiling. And once he could kill the bacteria, wine became what it is, wine, which is French wine, good wine. Then it was a German, Robert Koch, who was a general physician in Göttingen of Polish descent, who discovered tuberculosis is not because of heredity, but is caused by a bacteria. The bacteria had some features of a bacteria and some features of a fungus. That is why this was called mycobacterium. And mycobacterium, as you know, causes tuberculosis. Sir Lister was a surgeon, and he noticed that when he does surgery, many of the times the wound gets infected And he noticed that if he could treat his scalpel and other instruments with an antiseptic, then infection could be prevented. Hans Christian Graham attended a 15 days workshop in microbiology, and he developed what is known as Gram, which divides all bacteria into either gram positive or gram negative, a fundamental difference. Subsequently, Fleming discovered penicillin, and that was the beginning of the antibiotic era. Now, the eye can see things which are 1 millimeter or even smaller than 1 millimeter. Then you had light microscopy, which Leeuwenhoek started, and now we have very good microscopes. But it's the wavelength which decides what we can see and what we cannot see. And to see viruses, you need what is known as electron microscope. This is my picture, and it is ego which suggests that this is Ashok Ratan, because I have 200 different cells, and if I have 30 trillion cells which belong to me, I also harbor 80 different microbes, and they total up 38 trillion. There was a time when we used to feel that our cells are one, and the bacteria and the other microbes we harbor are 100. So that if there was a voting, then the bacteria will win any day. And so it's only ego which says that this is me and not a collection of microbes. In fact, National Institute of Health has funded billions of dollars to make a human atlas of the biomolecules that are in different parts of the body. I would start by saying that there are good microbes and there are bad microbes. Our forefathers knew about the good part. The curd that you eat nearly every day is because because of bacterial action. There are two bacteria which convert milk into curd. And that is why this bacteria is, or collection of curd, is always used to make more curd. Similarly, cheese is as a consequence of action of various microbes. Wine, I've already talked to you about, that Louis Pasteur discovered that wine is fermentation because of activity of certain bacteria, but only when it is contaminated that it gets bad. Similarly, penicillium, which is a fungus, gave us the antibiotic penicillin. Another bacteria gave us vancomycin. Lovastatin, tacrolimus, which is used after kidney transplant, also comes from streptomyces, and so does lovastatin, which we use to lower our lipids, comes from aspergillus. Bacteria also have viruses, and these viruses are known as bacteriophages. What they do is that when they attach themselves to the bacteria, they dig holes. And nowadays, scientists are using this information to see whether they could be bacteriophages could be used as antibiotics because we are running out of new antibiotics. But of course, we know that if there are good bacteria, there are also bad pathogens. Pathogens will be those which instead of helping us, harm us. So there are bacteria like tuberculosis, Staphylococcus, Escherichia coli, Salmonella, Lyme's disease, etc., which cause harm to us. Today, we would focus on viruses. And viruses are tiny structures, cannot be seen by naked eye. We need electron microscope if you want to see, but we can see the effect of viruses. Normally, human body consists of both DNA and RNA. The central dogma is that all information is present in DNA. DNA is converted into RNA, and there are three types of RNAs. Then RNA will be converted into protein, which will make our body structure. So the information is contained in DNA. The messenger is the RNA, and it makes proteins which make us. This is what happens in human body. But in viruses, either you have DNA or you have RNA. You don't have both. There are various structures of viruses. You would have heard of rabies, which is caused by a virus which looks like a bullet. Then there's herpes virus, there's papilloma virus, which causes cervical cancer, and there is rotavirus, which causes diarrhea in children. So viral infections are all around us. To begin, the common cold is caused by various viruses, and there are hundreds of rhinoviruses which causes common cold. And that is why we keep getting common cold as winter approaches, we get common cold. Sometimes there are outbreaks of eye infection which causes conjunctivitis. These are also caused by viruses. Then sometimes we have affection of the brains, and that is caused as encephalitis or meningitis. And you might recall that in Gorakhpur, there used to be repeated outbreaks of Japanese encephalitis. Pharyngitis is quite common, and sometimes around the sides of the lips, we have herpes simplex, which keeps on having small blisters. Then mumps, many of the children have suffered from mumps before the vaccine became available, and now everybody takes vaccines so that mumps is prevented. Then hepatitis, there are hepatitis A and E, which are transmitted through dirty water, while hepatitis B and hepatitis C are through blood. Skin infections, I will talk more about varicella zoster. There is smallpox, there is papilloma virus, rubella, measles. Many of us have gone through that. Then it can cause pneumonia. And recently we came across COVID-19. Influenza is another one which is very common. Polio is another one that we'll deal with. Gastroenteritis is caused by either rotavirus in children or norovirus in adults. Then pancreatitis can also be there, and some of the viruses can be transmitted through sexual intercourse. The virus itself is a very simple structure. It either has a DNA in the genome or it has an RNA. This DNA could be single-stranded or could be in fragments. Similarly, RNA could be single or it could be in fragments. This is then coated by a protein coat, and then it has spikes, which are the envelope proteins by which it attaches itself to human host. That's all. It doesn't have anything else. It doesn't have a respiratory system. It doesn't have a digestive system. It doesn't have a reproductive system. It just has either DNA or RNA coated by a round of proteins and some structure to bind to human cells. And it multiplies inside cells. So outside the human host or outside the cell, the virus is inactive. In a way, it is dead. It's only when it enters inside the cell that it acts, it is live and starts multiplying. So it is the ultimate parasite because it gets nothing to the table and it uses host enzymes to duplicate itself. Now, one of the commonest infection after common cold is a severer form of common cold, and that's known as influenza. In influenza, which is by a virus, there's fever, there's muscle ache, and there's chills, there is cough, there's weakness, there may be diarrhea, there may be vomiting, fainting, or sore throat. So you feel weak for at least a week. Common cold is just sniffling and you can keep working. But when an influenza hits you, you're flattened. And what happens is the influenza is an RNA virus, and the virus is in bits and pieces. There are many pieces, as you see here, there are 8 pieces of the RNA, and these can mix and match, and they code for two specific proteins, which are known as hemagglutinin because they bind to the RBC, and neuraminidase, which is like a scissors, which releases the virus from our nasal tissues. These can be present in various permutation and combination. The virus is inhaled, it multiplies in our upper respiratory tract, and then it infects the lungs and it can kill. In fact, in 1918, after the First World War, there was a pandemic of influenza, and that killed more persons than soldiers lost during the 4 years of World War I. Even after 1918, where 50 million deaths occurred, and it was known as Spanish flu, there has been small pandemics. And of course, all of us remember the last few years where it is guesstimated that 5 billion deaths occurred because of COVID-19 pandemic. So sometimes we get influenza from chicken, sometimes we get from swine, and then after it has amplified in chicken or swine, then it comes to man, and from man it is transferred to other men. So when you look at it, influenza actually is an infection of the animals, and we are accidental hosts. So that's why this is known as a zoonotic disease. Except that in this zoonotic disease, man will transfer to another man. And so the children have written that if you have influenza, then there are 5 things you should do. You should cover your mouth and nose when coughing or sneezing. This is known as respiratory etiquette. You should wash your hands regularly. You should take plenty of water and rest. If you have some other illness like rheumatoid arthritis, etc., then you should take antivirals, and antibiotics have no action on viruses. So there is no need for taking antibiotics. There are 5 ways that children say you can avoid getting the flu. One is by taking a flu vaccination. Since the virus changes its structure every year, the vaccine that you use would be effective only for that year. So every year you would have to take a vaccine. You should avoid being around persons who are sick. Do not touch your eyes, nose, and mouth, because that is how germs will get into your body. You should clean and disinfect surfaces in your offices and keep it neat and clean. And you should wash your hands with soap and water as frequently as possible. However, besides taking vaccination, there are drugs which are available which can be taken, because there are many deaths, especially in children below 5 years of age and adults over 55 years of age because of influenza. After an RNA virus, we move on to a DNA virus. Smallpox, which we have eradicated, used to kill a large number of persons. I have shown 2 photographs of personalities from Bollywood suffered from smallpox, which affects the skin. The vaccination against smallpox was accidentally discovered by Edward Jenner. Edward Jenner was a general physician in UK, and he noticed that milkmaids who suffer from cowpox do not suffer from smallpox. So cowpox would cause pox disease in cows, but will cause very little infection in human beings. So this was the first vaccination, because cowpox is known as vaccinia virus. Vaccinia virus was used to immunize persons, and they would have protection against smallpox. And using this, WHO was successful in eradicating smallpox from the world. However, its cousin, known as monkeypox and now known as mpox, which initially was seen in monkeys, but maybe occurs in rodents. From rodents, it causes infection in man, and then from man to man infection is possible. So there is a animal cycle where man is an accidental host, but once the man gets infected, he can infect other animals as well as human beings. with this mpox virus. Normally, in every infection, there is an incubation period where infection has occurred, but it cannot be seen. Then, after a few days, where the number of virus in the body increases, there is a febrile stage, a fever stage. Then it is followed by rash, and as the rash dries up, there is recovery. In some, there could be complications, and various complications are possible. And that is why during this time, a person should be isolated and he should not go to work. And persons around him should take precautions so that the virus does not spread from one person to another person. Sometimes additional precautions need to be put in place depending upon what is our understanding on how the virus moves from one person to another person. And of course, as indicated by the children, we should wash our hands. In the hospital, whenever you take care of patients, WHO says there are 5 moments where you must wash your hands before touching any patient, after touching any patient, before doing any clean investigation or interventions, before touching their secretions, and then after touching the surrounding area, we must wash our hands. If we cannot wash our hands and they are obviously dirty, then we can use alcohol rubs instead of washing our hands. And of course, we must always practice respiratory hygiene and cough etiquette. Then we move on to chickenpox. Chickenpox, as the name indicates, is normally a mild disease. It occurs all over the body, but it is characterized that at one stage you would find many stages of viral replication. Papules, it is causing ulcers, it is causing blisters. So if it occurs at one go, if you see 3 different stages at one go, then it is normally chickenpox. In the recent past, more elderly persons are getting chickenpox. After chickenpox, it clears out within a week or so. Sometimes after a long interval, it reappears as herpes zoster. So chickenpox and herpes zoster are caused by the same virus, herpes zoster virus, and there's a vaccine available which would help us avoid the very painful herpes zoster infection. Polio is one which affects the nerves, and when it affects the nerves, it wastes the body. So the muscles get wasted, the nerves are damaged, and the bone becomes very fragile. 2 important persons whom we know have suffered from polio are US President Franklin Roosevelt, who was the first president and the only president to serve 4 terms. Normally, as you know, presidents in USA can serve only 2 terms of 4 years each. But because the Second World War was raging during that time, Roosevelt was elected 4 times, and during the fourth 4 years term, he expired. And we have our own B.S. Chandrasekhar, a very good fast spin bowler. He had polio in his bowling arm, and because of that, there was great flexibility in his hand, in his arm, that he could give fastish off breaks and get the persons out, off breaks and leg breaks. After polio, which has been eradicated or nearly eradicated because of the vaccine available, we have now vector-borne, also known as arthropod-borne viruses like dengue virus, chikungunya virus, yellow fever virus. Yellow fever doesn't occur in India, and Zika, which also occurs in India. Dengue virus causes infection and there is fever for 1 or 2 days. During this time, the first 2-3 days are not as serious as the next 3 days because after the initial attack of fever, there's normally leaking of plasma from the vessels, which can cause shock. If this is not recognized and if a replacement of fluid does not occur, then the person would die. So the death in dengue is because we fail to recognize that it on the fourth, fifth, and sixth day there is leakage of and leakage of plasma leading to death. Sometimes there are also hemorrhages. These are known as petechial hemorrhages, and hemorrhages also will complicate the matter. So death occurs because of dengue hemorrhagic fever. There's fever, there's hemorrhages. This is because the platelets have become less than 100,000. Today, in the newspaper, they brought out that ways to protect yourself against dengue is remove mosquito habitats. Dengue is transmitted by female Aedes aegypti mosquitoes. These Aedes aegypti mosquito breed in fresh water. So they will not breed in stagnant water where anopheles which transmit malaria breeds, but dengue virus breeds in fresh water. So that is collection you might have kept in your overhead tanks or in your coolers, etc. So you should remove all that water because otherwise the mosquitoes will breed there and they can fly only half a kilometer. So the virus has the mosquito has to be living near your house. So keep your house and surrounding clean. Use mosquito repellent. They bite during the morning when you go for morning walk or at dusk during the evening. So you should be careful that you wear long sleeve clothes so that there's no exposed part to bite, and keep your home clean. Use netting so that mosquitoes do not come inside, and clean your surroundings. During the monsoons time, there is also viral conjunctivitis, which can be seen by pink or red eyes, water, watery eyes, and feeling of pain. Sometimes this is also sore throat, swollen eyes, and you should then avoid going out in the sun where don't touch your eyes and don't go to office. Stay at home to become well. Most of the viral infections have been they are there for a short time, and or there's a vaccine available. Of course, there are some for which vaccines are available, and for some like HIV and hepatitis C, where people have been trying to make vaccines without success. Recently, COVID could be controlled because many scientists worked and made vaccine at pandemic speed, and normally it takes many years, but because of the havoc brought about by COVID, many of the activities which are done sequentially were done simultaneously, and the government of US put in a lot of money to the pharmaceutical industries so that different vaccines were made available. And of course, India also produced at least two different type of vaccines, and that helped in control the infection. This is also partly because we understood that the virus binds to ACE2 receptors on human cells, and if antibodies are available, then the virus will be neutralized and it will not be able to bind. If it cannot bind, then it cannot enter inside the cell and we will be protected. CDC Atlanta gives a list of adult vaccination. Okay, so tuberculosis is one of the top 10 deadliest disease, and it has been estimated that India loses 13,000 crores because of tuberculosis in our workforce. So Government of India and CII has promised to work together to promote TB-free workplace. In that, three things are required. One is sensitization of our workers that they either have TB or they're susceptible to TB. That can be checked by doing screening. And nowadays, there is a skin test available which is replacing Mantoux test, but it has antigens which are personal to Mycobacterium tuberculosis, so that non-specific reactions are minimized, or there are X-ray, mobile X-ray, which with artificial intelligence can indicate whether there is any hotspots in the lung. WHO also says that there are symptoms which are specific for tuberculosis. If a person has cough for more than 2 weeks, fever for more than 2 weeks, night sweats, and loss of weight, these four symptoms are suggestive of tuberculosis. So, and as you know, Government of India gives free treatment to everybody. Along with free treatment, they also give some nutritional support in one for 6 months, because they have noticed that deaths from tuberculosis occur when a person is very thin and frail. So workplace, it's important to make our workplace TB free, because workers spend most of the time at workplace. Difficult for program to reach workers, that is TB control program. And India has, WHO wants that by 2030 TB should be eradicated. India has promised that by 2025 we will do that. So there is essential that we all work together to identify active cases, put them under treatment, and ensure that there is no loss of productivity because of tuberculosis. It's also essential that we work on removing stigma, because tuberculosis is a completely treatable disease. Many things are being put in place, and so it is something that CII and Government of India has committed together to make sure that our workplace remains free of tuberculosis. For that to happen, 6 activities have to be put in place together. I understand that people say that because of COVID-19, many of us have started working from home. And Uh, it's been suggested that if you are working from home, you should wake up early, have a regular workout, you should nurture your hobby, eat healthy food, and sleep and have adequate sleep besides fulfilling your work that you're committed. To help you do that, Red Cliff Lab has the home collection unit. We have 71 labs and we are growing with one lab every week or so. Different parts of India. We cover the whole of India. There are hundreds of phlebotomists who will come home and collect your sample. As soon as the sample is collected, it is barcoded at site so that there is linkage of test requisition form and the sample so that there is no chance of any mismatch. We use standard protocols for sample collection and transportation. There is absolutely no loss of sample. There is continuous monitoring of temperature during transit so that there is no deterioration before it reaches the lab. There is rapid and secure transport of samples to the nearest lab. In the lab, there is standard protocol for receiving the sample. Time and temperature is monitored. Then we have state-of-the-art equipments. We do daily internal quality controls and we participate in every external quality assurance programs. There are pathologists in every lab which review the report. We give critical call out whenever the reports exceeds or indicate that the person may be suffering from severe infection. We have digital secure transfer of results. Storage of samples are kept for some time so that if repeat testing or additional testing is required, it can be done. And we have a responsive and positive leadership to the work in the lab. We have also added X-rays and ultrasound. So we could be your partner in making sure that you remain healthy.